Yes, good morning, everyone. Happy to be here again for another Jade AGM. Just want to give us a few quick opening remarks. Last year, we looked at holistic health. That was the major theme. And I must say, I'm very happy that we're talking about integrative health care for this year. Oh, okay. Yes, so I'm very encouraged that we're talking about integrative healthcare for this year. So the way I see it is our whole understanding and the way we treat persons with intellectual disability has actually become increasingly sophisticated with time. And that's something that I think is very encouraging. In the past, if you look at the history of persons with intellectual disability, there was a time where persons saw this as almost a punishment from God, and families and others would be particularly distraught if a relative or someone in the family had intellectual disability. Now in the modern time, we appreciate that it is actually a variant of normal, and we actually understand that it's something that with attention and time can actually allow persons to be able to be integrated in our society successfully. Our language has changed. Some of the words we use to describe persons with intellectual disability has changed. And now we've adopted the biopsychosocial model when we look at persons with intellectual disability, looking at both the biological, psychological, and of course the social aspects of what can make their quality of life better. Another important area is family health systems. We now appreciate that persons with intellectual disability aren't necessarily a burden to family members, but in fact can actually add a wealth of emotional experience to families. But, as is the case with many groups, persons with intellectual disability can exert some degree of burden on caregivers. And so we appreciate that we also have to address that, especially in regards to parents. Some of the work that Jade has done this year has included health fairs and also a lot of educational work with parents. And I really have to commend Ms. McCoy for appreciating the importance of going across Jamaica, not just Kingston and St. Andrew, but other areas all across Jamaica to try and provide additional support for parents in that way. So when we talk about integrative healthcare, I think that's a perfect example of now this increasingly sophisticated way we need to approach the health of persons with intellectual disability. It's not just something that can be left to teachers and guidance counselors, though of course they have a huge role to play. Psychiatrists and mental health professionals have a huge role to play. Certainly, I see persons with intellectual disability regularly at my hospital. And I'm very happy to say that with the addition of a psychologist, a clinical psychologist, Dr. Simpson, we've actually been able to address the needs of persons with intellectual disability in a more comprehensive way, as he's able to do assessments, and that can also help with psycho-educating family members and increasing the support network for persons with intellectual disability. Last year, we had an occupational health practitioner and a dentist on our panel. This year, we have an esteemed pharmacist and also a very well-respected social worker here. So you can see that the whole concept of integrative healthcare, where we bring different aspects of health together and coordinate it, is something that we don't only believe in theory, but something we would like to showcase to all of you. Finally, I really do want to pay special respects to Dr. Daly. She's actually I would call her one of my teachers. She's a psychologist at the University of the West Indies, but she also has a lot of experience with Ministry of Education, and she's been working with Jade for a long time, made huge contributions in the area of public education and advocacy. And recently, I discovered that she, along with the Jamaica Psychological Association, are now offering a certification course in psychoeducation. And what that means is that we'll now be increasing the capacity to do assessments and tests. Anybody in this community knows that. Yeah, I think that deserves a round of applause. I agree, actually. Everybody in this community knows that there are significant barriers to getting assessment. When we try and do it through publicly provided sources, sometimes you have to wait months, several months to get an assessment. And reality is that the private options can sometimes be a bit onerous for regular Jamaicans. So I think the efforts of Dr. Daly and the Jamaica Psychological Association really, really have to be applauded, because this hopefully will mean that more persons will be able to get the assessment they need and done in a timely manner. All right, so with that being said, let me go on to introduce our panelists today. First, we have Ms. Shireen Williams Hemmings. She's a clinical social worker with a Master's of Social Work degree from the University of the West Indies and a certificate in Leadership and Management in Health from the University of Washington. She has 17 years of experience, though she doesn't look it, working with vulnerable populations, and has served in her current capacity as Director of the Department of Medical Social Work for the past 7 years. She also uses her knowledge of trauma-informed care to guide her interventions and uses a holistic approach to address psychosocial needs using an eclectic treatment modality. Next to me here, please, excuse me if I don't get your first name right. Thank you. So I have Miss Megan Anderson. She's a registered pharmacist, pharmacy owner, entrepreneur, and a part-time lecturer. So truly a jack of all trades with over 20 years of sales and marketing experience. Also don't think she shows it. In the pharmaceutical industry and 8 years at the University of Technology externship as an externship preceptor. She holds a bachelor's in pharmacy from the University of Technology and a master's in business administration, in business management, I should say, from Nova Southeastern University. She's also a parent of a young child with intellectual disability. Oh, yes, sorry. Before we get into the panel discussion, we would also like to do some special greetings. So at this point, let me acknowledge Mrs. Dion Gale, the Assistant Chief Education Officer for Ministry of Education. Oh, yes, our representative is here. Could you please stand so persons can see you as well and we can acknowledge you? Thank you. Thank you very much. We have Mrs. Dion Jennings, who is the Acting Permanent Secretary for Ministry of Labor and Social Security. Oh, she's not here presently with us, but I'm sure she's with us in spirit. We have Mr. Atsushi Nakagawa, who is the resident representative for the Japan International Cooperation Agency, or JICA. Thank you, sir. And then finally, we have Ms. Sheon Palmer, who's the NSCP/Empowerment Officer from Heart NSTA Trust. Yeah. Thank you very much. And also, am I forgetting someone? Oh, okay. So as well, I now want to introduce entertainment. Oh, okay. Sorry, we're going to hold it on for now. All right. So now, I'm going to move on to the panel discussion. Oh, sorry. Which greeting am I forgetting? Oh, okay, I'm sorry. I think now I need to actually ask you guys to come to the front. So
We will ask Mrs. Williams, representing Mrs. Dion Gale Jones from the Ministry of Education, Special Education Unit, to come with her greetings. And this will be followed by Mr. Nakagawa and then Ms. Sheon.
Good afternoon, everybody. Distinguished guests, members of the board of the Jamaican Association on Intellectual Disabilities, stakeholders, friends, and most importantly, representatives of the population that we serve. Good afternoon. It is my honor to bring warm greetings on behalf of my Assistant Chief Education Officer in the Special Education Unit, Ms. Dion Gale, and by extension, the Ministry of Education, Skills, Youth, and Information. The ministry extends heartfelt congratulations to Jade on the occasion of its 69th annual general meeting. Nearly 7 years of advocacy, education, and service is no small feat. It is a testament to the strength of your vision and the power of your commitment to improving the lives of individuals with intellectual disabilities in Jamaica. Give them a clap, man. The ministry is proud of the tremendous collaboration we share with Jade. Together, we have made meaningful strides in building educational environments and supporting families through critical resources and professional guidance. Our partnership continues to reflect our shared belief that every individual, regardless of ability, deserves the opportunity to learn, grow, and contribute to society with dignity and purpose. We look forward to continuing this vital work together, building on the foundation of mutual respect, innovation, and unwavering advocacy for those we serve. On behalf of the ministry, I commend the leadership, staff, and the partners of Jade for your extraordinary service and dedication. May this AGM be a time of reflection, recognition, and renewed commitment. Thank you all, and I wish you the very best.
Good morning, everyone. Wagwan. Did I say it correctly? Oh, okay. I don't think so, but it's okay. Thank you very much. It is a true honor to stand before you today. It's 1 month into my posting as a resident representative of JICA Jamaica here in this beautiful country. So I'm still in the early days of settling in and learning about the full scope of our collaborative efforts. I feel a deep sense of respect and admiration for the legacy of partnership that has brought us here. Today marks the 69th annual general meeting of JADE. That's an extraordinary achievement, nearly 7 decades of services, advocacy, and education for persons with intellectual disabilities. This milestone reflects not only your endurance as an institution, but your deep, unwavering commitment to building a more inclusive and supportive society. JICA is proud to have been a part of that journey for over 20 years. Through the technical cooperation agreement between Japan and Jamaican government, we have had the privilege of placing Japan Overseas Cooperation volunteers within your network of schools, supporting your work, and in turn, learning from your team and the students and communities you serve. We've also supported short-term training opportunities through the knowledge co-creation programs, strengthening capacities and fostering cross-cultural exchange. And I understand there are other areas where our paths continue to intersect. While I am not yet in the position to speak in depth about our current initiatives, I want to express JICA's commitment to continued collaboration. You are not only our partners, but also our teachers. The work you do speaks to the heart of inclusive development and reminds us of shared responsibility we hold in ensuring that no one is left behind. As I look ahead to the months and years to come, I do so with eagerness to deepen partnership, to listen and learn from you, and to continue building bridges of mutual respect and progress. On behalf of JICA Jamaica, I extend my heartfelt congratulations on this remarkable 69th Annual General Meeting. May the work you do continue to flourish, inspire, and transform lives across Jamaica. Thank you very much.
Good afternoon, everyone. How are we doing today? All right. I stand here giving greetings on behalf of Heart NSDA Trust, and I'm here to say that we are proud of the partnership we have with Jade. Partnership with Jade does not stand within a parish, but it spreads across the island, and it tends to go towards our underpinning factors of nation building and the Ministry of Education, no one left behind. We are grateful for the partnership. I want to speak about 4 particular areas that we really are grateful for. We have our CTI trainings, which is where we offer added training to our adult learners. We have the empowerment program, which is big, and I heard about it earlier in the presentations. Thank you for continuing to partner with us as we all seek means and ways for our learners to move on in this world and be a part of the world and not be left behind. And I must applaud on behalf of Heart the dual relationship that we have. It's not just that we're taking or we're giving, but there is always an opportunity for staff members like myself and others to learn, to get a little bit granular into what we need to do at Heart to facilitate further learning or better learning, be it a revision of our learner guides, which is one activity that we're doing. As many of us, especially the teachers, will know that learner guides are a little above what would have been presented. And we have partnered with Jade and we started the revision of learner guides. Thank you for that partnership. And as we gear towards another year, I tell you thanks once more, and I look forward to the continued partnership, learning, growth, or training, or certification. And may I say, we had at least 6 persons doing some certification in just last week. And while it had been a difficult process, what I take from it is that I am able to present tangible report to say these are the challenges we have been speaking about. So now I have evidence to back some of the things that we have been saying. So I look forward to the continued partnership with Jade. Thank you.
Yes, okay. So now that we've gotten the greetings out of the way, thank you very much, guys. We appreciate the continued partnerships. We will move on to the highly anticipated, long-awaited panel discussions. So I'm going to start with you, Miss Williams-Hemmings, or Mrs. Williams-Hemmings, I should say. So I know, as someone that works in the mental health field, how important being a social worker is. You guys really play a critical role. We would love to hear from you, your thoughts, your experiences, your feelings about being a social worker and working with persons with intellectual disability. So I was told you'll have about 3 minutes to make your presentation. So please feel free to go ahead.
Good afternoon, everyone.
It is indeed a pleasure to be here, to be a part of your 69th annual general meeting, as well as to speak as a member of your panel. Diving right into it. For 17 years, I have worked within a clinical facility. So I see just about everything that you can think of. And in my bio, it mentioned working closely with vulnerable populations. And at the heart of social work is ensuring that, and this is a little bit into the education ministry's mantra, nobody being left behind. We have persons who are ostracized, who are exempted from basic services within our society. As social workers, we have we make a special effort to ensure that access to services is readily available, and as a matter of accessing these care, there is equity and there is fairness. I see no difference between someone who is considered to be living with an intellectual disability versus another person. The core of my way of intervening is looking at the individual, so individuation. I see the person for who they are, not for their diagnosis. I meet with them, meet with their families to see how best I can help them to navigate not only our health facility, but to navigate challenges that they're experiencing. So it has been a pleasure for me just helping persons to navigate their challenges, to see how best we can find solutions, not in isolation of their environments, because we have a symbiotic relationship with our environment. So it's finding out what resources are available to them to ensure that whatever plans we have created within a clinical setting, that transcends into their environment, because we want sustainability. We want persons to be able to manage their own affairs eventually. So it might require linking them to external services if we're unable to do so. So it has been a whirlwind. It has been difficult or challenging at times, because as we all know, the services that are available for those who are most vulnerable, those who are living at or below the poverty line, is limited, right? Resources are very scarce, they're very few, and everybody is literally fighting for the same sort of services. So we have to get creative. So we work closely with not just government agencies, but also private entities who provide support. So it's really a matter of being creative in navigating persons' realities to ensure that their felt needs are addressed so that they are better able to function within their environment, regardless of their limitations, regardless of their uniqueness or unique challenges.
Wow, thank you very much. You're clearly actually a very impressive speaker as well. You didn't pause. You went straight ahead. As I heard you talk, I know that the reality for most social workers in Jamaica is that you're dealing with significant constraints. And so again, I think that highlights why integrative healthcare can be so important, because when we're in an environment where we have such little resources available, we need to maximize our efficiency by working together. What has been your experience in collaborating with other healthcare providers?
Okay, thank you for that. So it has been difficult in some instances, but also very fulfilling. Difficult in that you're constantly training persons or reminding persons that the whole is greater than the sum of its parts. So a holistic point of view, it's not just about the medical, because I can speak mostly for the medical setting, since that's where I have almost 2 decades of practice. So it's to pay attention to the biopsychosocial. Don't just treat the patient in isolation of their psychological issues or their social issues, because I guarantee you that they will return to hospital if we're not addressing issues. But they're total biopsychosocial issues. But I must say that
the journey has gotten easier in that persons are becoming more aware of the importance or the value added in getting everyone involved. So it's not just the medical practitioners, not just the nurses, but also getting psychologists involved, getting social workers involved. So it has gotten better over the years, and we work from a multidisciplinary team. That's our approach in managing our cases. So that's what I can speak to definitively from my area. So we work very closely with doctors. We do discharge planning. We do case management because we want to ensure that all facets of the individual's life is being attended to, because we want to help persons to be the best version of themselves. We want to help them to navigate their own unique challenges, their own innate strengths. Some persons aren't even aware of their strengths, so we have to dig deep, ensure that we're looking at the big picture. We're looking at how our persons living with intellectual disabilities will function once they're on their own, help them to navigate the world, their new journey. So it has gotten better. I'm thankful that we have been steadfast in our drive to ensuring that we operate from a holistic approach, and I think that has made significant strides. So we're not just looking at the surface level items, but the broader picture.
Okay, thank you. Not to put you on the spot, but do you have any success stories from your experience?
Yeah, I can think one comes readily to mind, and it's going to delve a little bit into medication adherence, because we see not just persons who have acute issues, but persons who are living with lifelong issues that requires medication. We have persons who have comorbidities as well that needs proper management. So having worked, and I've worked with multiple persons who are living with an intellectual disability, but this particular person, we're having a challenge helping her to maintain adherence. So she's seemingly fully functional, but her ability to read is something that was missed quite early. So she was not taking the medications properly, and the condition that she had requires strict adherence. So working with her and realizing that that is a challenge, that is a barrier for her, it was a matter of now speaking with the pharmacist too to see how we can break it down a little bit to say, all right, this is how you know when to take your medication, what medication, and the duration of each dose. Sorry, not duration, but the frequency of each dose. In addition to linking her to Jamaica Foundation for Lifelong Learning to get that remedial intervention to ensure that the issues that she's having does not recur. Because again, we cannot treat with someone in isolation of their environment and their ability to function. So it's seeing what the issue that we're having or we're seeing in hospital, but we're looking beyond how can we completely resolve this. So of course, trying to see if a different regime could have been prescribed to her, working closely with the pharmacist. You have someone who spoke about adherence, and of course the social worker ensuring that everybody was playing their part to ensure that the patient was on her meds and taking them in appropriate dosage and frequency, and her condition did improve because we identified the root cause, and she was very excited as she got to a stage where she was able to read and to spell. She would come back and let us know. So it was very fulfilling, and that's, I don't know for many persons if you're aware of social work, but when you see persons transitioning from point A to point B and there's improvement, it gives you hope, it gives you that drive, that zeal to continue. And that person was one such story.
Amazing. Amazing. I think we should certainly clap for that. And I think your story actually emphasizes some of the key aspects of integrative healthcare, because the reality is something like medication adherence I mean, of course, that's Ms. Anderson's area, but at the same time, in integrative healthcare, we believe in something called task sharing. So sometimes tasks can be split even among persons who it may not be necessarily their area of expertise, and it's not uncommon for social workers to help with medication adherence. So thank you for that. My last question for you is regarding parents, families. How would you explain to them the role that social workers can play in helping them to assist their relatives who may have intellectual disability?
How social workers can help parents. All right, so we do quite a bit of psychoeducation. We want to ensure that the information that is being received is interpreted and is accurate based on how it was sent by the receiver, the sender, right? It was communicated by the sender. So oftentimes we find that loved ones, patients, or or service users may be informed about various things, but they're not necessarily sure of what exactly was said to them. So we act as a mediator, or act as an intermediary to ensure that the information that was communicated is understood. For us as social workers, helping parents or guardians to lean on us is to help them to not only help their loved one, but also to help themselves to not become burnout, to not become overwhelmed, because there is such a thing as caregiver burnout, right? So providing information, I believe, is the appropriate medium through which we can help them to understand our roles and our functions, right? If you are able to recognize that there is someone out there who can help you to navigate the complexities of the health sector, the health system, then you're better able to gain access, as well as to be willing to even try, right? So it's helping them to recognize that they're not alone on this journey, and should they have any difficulty, that they're open and they're willing to seek the help. So it's to create that environment, first and foremost, building rapport, create that environment that provides comfort, and an environment that is free from judgment and criticism, right? So they feel open to come, because the reality of the situation is we are more aware of what exists and how the different services will be beneficial to their loved ones. So providing that information and being compassionate, right, I believe is the road to go.
Okay, great. Great, thank you. Sure, thanks. Yes, great, thank you. And I'm happy that you highlighted the importance of being compassionate while also doing the technical aspect of your job. So we actually have a audience question. So I think she can go ahead now.
Good afternoon, everyone. I do appreciate all the information just now, but how many social workers are in the major hospitals in Jamaica? Because there are times when our parents, even us as stakeholders from the school, go to the hospital with children who fall sick while at school, and when they go to the hospital, it's forever. Right? The information that parents need to get, we don't know how to help. How many social workers are there in the major hospitals?
Thank you for that question. It's a difficult one to respond to in terms of the actual numbers in each facility. What I can say, though, is that there is at least one social worker at every hospital, public hospital, and I'm going to add the UHWI in that listing as well, as though we are considered to be part private. We have the most social workers in any medical facility. So there is a total of 12 with the exclusion of myself. All right, so no, that's not true. We have 11 with the exclusion of myself, and if needed, I jump on the floor just the same. So in total, we have 12 trained social workers with a minimum of a bachelor's in social work. In terms of navigating the health facilities, I could not speak to how frequently each social worker would be in office, because they also service other health facilities, so like clinics, right? So it's not a lot of us when you look at the scope of and the volume of work that we have to do, but there is at least one in every facility. If it is that you require a listing of, say, the social workers and a contact number, that's something that I could work on, but I'm not able to tell you definitively how many are in each, but I know that there is at least one in each facility. Yes.
My question to you, Mrs. Hemmings, is when you go into the hospital setting, how do you access the social worker? Because the medical practitioners are not introducing the patients to the care of the social worker. At what stage? Where? Is it at the reception area that you can request to speak to a social worker? Because this is new to me as well. You know, I know they're there, but I'm trying to think in my head, how would I find a social worker if I walk into a public hospital?
Okay, thank you. Just to take you back a little bit, when I mentioned it was teething pains at time in terms of a collaborative sort of work, because some medical practitioners were not familiar with the roles and functions of social workers. So then they would not refer all patients who require that referral to a social worker. So it has been quite a bit of education and maintaining presence as much as possible, right? So in terms of your direct question, oftentimes referrals comes directly from the doctors, or nurses may refer patients as well. However, I can speak freely for UHWI where a person can walk in. So once you are a patient of the hospital and you are having any challenge, you can walk into my department and ask to speak with a social worker. But you have to be a patient, an active patient. And that's because we service the patients, we service the hospitals. So whether as an inpatient or an outpatient, you have access to us, right? So you can just ask. Outside of that, you can ask the medical team, or you can walk into our office to gain access to us.
Okay, so I think we should all give a round of applause once again. You're clapping yourself, but that's very gracious. And now I want to move on to Ms. Anderson. So Ms. Anderson, we're very eagerly anticipating your presentation. Please feel free to go ahead.
Afternoon. I will first give my disclaimer. I am the mother of an 11-year-old, Daniel Joel Destiny Anderson, who is now 11 years old, well, next week, Wednesday, and she is a child with Down syndrome. My journey as a pharmacist started 30 years ago. And as a pharmacist, it's an integral part for us to be trained on patient counseling. And not only, it has evolved over the years where when we're trained at UWI or UTech, 4 years to 5 years program, our patient counseling is one that has taken on a role where we no longer tell the patient. We're now to engage and to work with the patient along with their healthcare providers. So it is now called concordance patient counseling. No, that is what we're taught. What happens when we get into the work world, there may be segments of us who do it consistently, and pay attention and give the time and care. Now, as a parent who personally goes through or knows what a child with intellectual disability presents with, it makes me even more alert, aware, and I'm wearing two hats. Not only am I involved with children with ID, I have two workers right there. I have Tashiana, who has a 7-year-old child, Akilia, with autism, moderate autism, my technician in my dispensary. And I also have Chanel, raise your hand, Chanel, who has a 7-year-old child, Aiden, who has autism, mild autism rather, but his primary is ADHD. And so we have had to, over the years, navigate how we manage our children personally, and with that, our sensitivities when children present to the pharmacy, or sensibilities, one, we take them out of the line. Two, we spend time with these patients because we know firsthand what the challenges are that we present with, because oftentimes the communication, just writing it on the prescription 1-3 times a day, 8 hours, how is it going to be translated in ensuring that there's compliance, and at the end of the day our aim is for patients to get better and get well. That is when our job is done as a part of the healthcare team. So we have almost every paraphernalia you can think of in aiding and demonstrating how and showing. We'd have to need, Madam President, a workshop with parents to I have my whole things over there, so we don't even have the time to show hands-on. Asthmatic come in, a diabetic comes in, giving instructions, and then not only doing that, following up and ensuring that they understand, and two, that there's improvement in a child. Because we know that as parents, I won't even go there. 11 years ago, it was disaster. As somebody alluded to, things have changed. For me, when I heard that Daniel had Down syndrome, it is the end of the world. Things have changed, and access to information was told about Jade, registered with her. The Down Syndrome Association information has become more available. And so access to medication too, with the advent of NHF, has helped parents who are not yet signed on. That is one of the most beneficial programs that is available to help with the cost of goods, along medications, along with the grants that are available through Jade. Get logged on to the NHF. I have NHF here forms to show. We don't have the time for that, but what it does is it covers 28 chronic illnesses. My child, Tash, Chanel, every child that comes into the pharmacy and they don't have access to the medications, we get them signed up. We facilitate it and send them and take them in, because we know the importance and the challenges that we face when, one, the prescription is not written on a government prescription, they don't have access to the drug serve, and it's on a private prescription. We know the benefits that they can get. We get them signed in, take them in, and facilitate that process. We even source it for them because we know the stress. We call the drug serves around. I have connections. I've been in the industry for a while. I will make the calls to the different drug serves. We're located in Vineyard Town, New Dana Road Pharmacy. So drug serving Crossroad is there. Kingston Hospital is there. I'm in touch with National Chest. I've sent patients or even gone down to doing the part myself to source Epilim for a child epilepsy. So the resources are here. The pharmacist, if we log into and are sensitive to the needs of our ID patients, then the answers and the compliance to medication can be a thing of history if we all partner together.
I love that. Wow. Yes, round of applause, please. So it's very clear that our panelists today are powerful speakers. I'm actually very impressed. So firstly, let me commend you for being so considerate and thoughtful and bringing, your colleagues here with us, and being able to kind of share your story as a parent of someone who has intellectual disability. And what I like about your presentation, one of the things we talked about last year when we looked at holistic healthcare, is that the reality is that persons with intellectual disability are actually at increased risk for comorbidities.
Yes.
And those comorbidities are both mental health conditions, like ADHD, for instance, but also general physical health conditions. We know that they're increased risk of obesity, for instance. So the importance of them getting on the NHF where they get access to all that medication that covers multiple conditions is really important. So I really felt the passion coming out from your presentation, and we're very happy to have you here. My question to you, what do you think are some of the common factors that impact proper medication management?
I believe, as I alluded to before, and it's something that I practice community pharmacy. Not only am I passionate about Daniel, I'm also passionate about my profession. When we're trained, we're taught to engage and be one-on-one. You can't come to my window and get a paper bag. I have to touch base and understand that whatever I say on that label, you understand and it is communicated. So I find oftentimes is the interpretation of what is there, who understands every 8 hours, who understands every 6 hours, what does that mean to me? And then there are certain medications that allows for the medication to be titrated, meaning it takes over a number of days that you need to stay on it for it to show or to give certain benefits. How the information and translating that for them to understand, and not only for the patient directly in front of you, but the caregivers. By extension, how are they empowered to use an insulin syringe? How are they? We now have modern pens, pre-filled pens with needle tips that we not only dispense, but we show them. How do they use those medical devices? Your diabetes test, the strips, what do they do? So I think one of the major factors is understanding and translating that to be adherent to conform. I'd also alluded to the socio-economical challenges that are faced in accessing the drugs. The drugs not cheap, and it depends, especially the Concerta that Chanel's son is on. He's also on risperidone. Concerta is not cheap. Epilim that Tash Child was on for epilepsy, it's not cheap. So then the access is there where you have the NHF grants or whatever that gives a discount. And for children that are under 18, NHF covers up to 80% of the cost. Right. From Daniela to Daniel, log on to NHF. Parents get with it. And also in terms of their living condition, we find too when the person lives alone or cannot make decisions on their own, that somebody is there with them to translate all of what was communicated in terms of the medication. So I think those are probably the major factors I see when I'm faced with patients or parents or persons with intellectual disabilities.
Thank you.
Question, please. Thanks so much for that presentation. Because it's not only referring to persons with intellectual disability, but all of us.
All of us.
And the point is, when you get a medication to say, one person is getting 3 or 4 medications, and you are to you wake up 12 o'clock, 1 o'clock in the night and have a meal and take that medication?
Okay, thanks for that. So antibiotics tend to have that every 8 hours, every 6 hours, every 12 hours, because it is shown that when you maintain a person on this medication for this period of time, it eradicates or suppresses the bacteria. So you must take it within those specified time. What we do on our labels is to specify or give suggested time. So if there is a 8-hour medication, we try to start from 6 to, and then by 8 10, you should complete your course. So we give you suggestions. We not only recommend, we ask to find out what worked best for you and to see. For the last dose, though, if it is, for example, you have to be practical. For example, you're not going to be up for 10 o'clock. It won't be of detriment if you take it at 9 if you're going to lay down on your bed. But the most important thing is to ensure that you get that medication to make sure that that bacteria is suppressed.
So you're going to lose the benefits if you do not take it.
Yes. Yes, and you may have breakthroughs where if you're not consistent in taking the medication as you ought to, for the frequency and number of times for the day, for the duration of time, for the 7 days, then you may find that you may get suboptimal treatment in another 2 weeks. I say, why may have this still have the sore throat? Because the bacteria, the germs present may have the chance to re-energize and then gives you some level of resistance.
Great response. I also want to. Oh, okay. So we're going to take an audience question, but I just want to make a quick comment actually on something you had said. So just so everybody knows, maybe everyone in the room knows, but fortunately, Concerta was recently added to the NHF list. Yeah, unfortunately, it's not necessarily
Chanel has made
available.
several trips to Buster and can't get, it has been added.
But
That's a good point.
It's a move in the right direction. It's a move in the right direction.
I agree.
And also, my hospital also has an NHF pharmacy, Bellevue Hospital. So that's another pharmacy in the area that people can go to. Yeah, man. So you can add that to the list. Go ahead, please.
Good afternoon. Well, for example, going back to the antibiotics. So if it is that night dose, for example, you sleep and you forget, as you get up in the next morning, try and take the dose. The first thing that you take the next morning, you make it a priority for that particular medication. There are some medications, though, that you can't double up. For example, antipsychotics. There are some medications you ought not to. But for certain medications, like an antibiotic, for example, a pain medication, pressure medication, your sugar medication, if it is that you've forgotten, when you remember, you can take the dose.
Thank you.
Yeah.
Oh, okay.
Yes, sir.
I have an issue with parents whose children are diagnosed and they are encouraged to take medication, but they decide that I don't want my children on medication. I remember as a young teacher, there was a perception that if when you put a child on medication, you're turning that child into a zombie. I know it probably the parent is thinking about a particular psychotic medication kind of thing, but there is a perception out there among some parents that I don't want my child to be on any kind of continuous medication. And so they take it upon themselves to avoid giving the children the medication without thinking about the possible side effects. So I want us to, I would love for you to encourage parents whose children are supposed to be on medication about the importance of adhering to it and watching the benefits. And if they have challenges, if they have concerns, how it is that they can talk to their service providers. But to decide on your own not to give the children the medication is a dangerous.
I agree with that. I find the challenge, as you have expressed, greater with children who are on antipsychotics because of the side effects that can be intolerable. But oftentimes when they're given one medication, the known side effects are countered with another medication. And sometimes it takes a while, Doc, for example, risperidone or Concerta, 2 weeks up to a month to start seeing the effect. But the importance is that when you stay on it and you're under the care of a professional, express if there are symptoms, express if there are side effects, and those can be managed. If it is that your doc place you on a particular item and you're presenting with a certain side effect, not everybody presents with the same side effect or may experience a side effect. Mass John and Mass Tom may take the same medication and present differently because our makeup is differently. I find out we do a lot of hearsays, and with them say, who never say, get your own experience. And importance is that for the child to be treated, to be helped. So stay on the medication. If it is that the side effect is present, come back to doctor, even to me, come back to the pharmacist. I'm the one who gave it to you. Miss Anderson, you know, that my mouth start feeling dry, or for Aiden's son, I'm using them a lot. Aiden is on the risperidone and he start having muscle cramps, and all right, we said, you got the benztropine, make sure that he takes it, but you take the things that counter the effect. If there's hallucination, there's another medication that is put on. So the importance for adherence is unique. Every individual is unique, and although we have listed side effects, it doesn't mean that you will experience it at all or in the same way or in the same magnitude. And then for the same class of medication to help treat with the symptoms, there are different class of medication. There are several other forms to the one thing. So you have orange juice, you have fresh, you have juiciful, you have different types of medication that can give you the same or better effect. So it can be tailored once you communicate with us. The social worker tell us, say something happen when you take it, your head hurt you go to doctor, say, and then we can all come together collaboratively and make a decision that is fitting to you. But do not. It's detriment to stay off than it is to stay on medication that can be managed by professionals.
I just want to add briefly. Thank you for that response, very comprehensive. I don't have much to add in terms of the technical aspects of what she covered, but just that oftentimes, sadly in our culture, when persons may have some kind of mental health condition, and it may be, moderate, and we think medication might actually help in terms of improving their quality of life. Oftentimes parents may hold off until they become violent and aggressive and then require admission. Exactly. A lot of times what we're hopeful to do is to avoid admission, because admission is usually a very challenging experience for everyone. It's more work for us, but it's also more work for the family, and it can even be traumatic. So one of the things I'm hopeful that we can continue to do as healthcare providers is to let persons know that you don't have to wait until persons become violent or have issues at school or things like that. Sometimes the reason we're putting persons on medication when they may have a moderate degree of severity is because we're trying to avoid negative outcomes. And then, honestly, Ms. Anderson stole my thunder, because I sometimes feel that people underutilize pharmaceutical professionals, social workers, because they too also have a role to play. It's not uncommon that I've seen where maybe I may have prescribed medication, but after a discussion with a pharmaceutical professional and the social workers, they help with medication compliance as well, that it kind of resonates more with the relative. And so I just want to encourage persons, if you have your doubts, I know you may have spoken to the doctor already about it, but perhaps you want to hear it from another person, feel free to reach out to the pharmacist. Yes, please. That's what they're here for. I think we have one last question for Ms. Anderson at the back.
Good afternoon.
What if you can afford the medication, person who wants to get that? What you guys would do for that person to get medication?
If you cannot afford the medication, the options are there for don't trade offer grants on stuff when you pay and you get the receipt and you take them in to the office. No? You can get support there, but outside of that, you have the NHF card, you have one? I have a card, you're going to sign you.
Hi, I can lend a little to that discussion. So generally, social workers help persons who require assistance with, it could be medication, diagnostic procedures, or even in terms of getting surgical procedures done. Now, everything is, of course, dependent on the availability of resources, but whatever we have available to us in-house, we utilize, as well as we look at external agencies that can provide support for medications or for procedures that are required.
Yes, thank you for that information. I'm sure not everyone knew that. I just want to close this session. I think it's been a very productive and insightful session. I just want to close this session with two things, something I found interesting. So we speak a lot about the biopsychosocial model. So this belief that when we're treating a person, right, we're treating the person and not the condition. And what that means is that we have to pay attention to the biological, psychological, and social aspect of things. So by coincidence, this wasn't planned, guys. It's interesting that you have, someone who's very much rooted in the biological aspect of things. Somebody who has the psychological aspects of things, and of course, someone who also addresses the social, but yet a lot of crossover, right? Because we all are involved in each other section as well. So I'm very happy to be amongst them today. I think this was a great discussion, and let's hope that we can continue to have it.
Yes. Let's have more. Let's do a workshop.
That's a great idea.
Let's do a workshop.
And just to say, Ms. Anderson, I spoke to you earlier about a follow-up
Yes.
to this, because we need to have our parents in a session
I
where
agree.
we educate them about the use and adherence to medication in a very practical way.
Yes.
We have started this discussion today. And so we definitely will convene something like that to work with our parents, especially those with children who are on medication. So we look forward to that follow-up discussion.
Yeah. Call me, I'm ready. I'm available.
Someone is saying you have brought these ladies all the way here. Is there anything that you want to demonstrate to us very briefly?
Oh, okay. Carry the trolley as things come. All right. One simple thing I'll show them at home, put it on a table. This is what for Daniel, like we talked about earlier, there are existing comorbidities for children, Down syndrome, for her thyroid issues, obesity, pre-diabetic, we're trying to prevent going over that, and weight gain. For the children with, her daughter has seizures. So you find a lot of times, sometimes medications are not available in a liquid form, which is palatable and can go down with a teaspoon or syringe. Daniel is now 11, so based on our body weight and calculation, a syrup will be, some of the medications are available in a tablet form. I'm going to show you what I do with her to give her medication. She's on metformin twice a day, 500 milligram, and she's on Synthroid to help with her thyroid and help with her weight gain. And she does that in the mornings. So you don't have a tablet crusher. 2 spoons. These are my spoons from my yard. These are different syringes that we sell at the pharmacy that we can use to dose, especially that child like with cerebral palsy who can take them certain feed, they can feed with this. But let me show you what I do with this. So you get the medication. This spoon is a little bit more deeper. Crush now. Where do that to me? You want to crush on TV? So here we are crushing it. And then the next thing I would do is the cap. The cap. The dosing cap. Give me a check that for the Panadol. So we have our dosing cup. I pour this in there. Who's water? Can I borrow this water? So syrup is a natural suspending agent. And it masks the taste because metformin, for most of our medications are bitter because we swallow them. This one is immediate release, so it means that it can be crushed without affecting the integrity of it. We have red syrup. This strawberry give a nice masking, or simple syrup I buy it at the supermarket. These are mine.
Let me just take this moment to say this is not a product endorsement.
No, it's not. No. And I just take the spoon and I mix her own. And Danielle knows the routine. After she eats, she takes it up. She's children with Down syndrome are children of habit. And she knows the routine. So, and if I don't give it to her, she comes to me because she knows what we need to do. So simple thing like this, mix it around, not more than 2 teaspoons in terms of volume to make sure all of it goes. And it's a simple way that you can administer medication in the absence of having a syrup. All right?
So you guys can see she's definitely ready for the workshop. Okay.
You have more time? No. Because I will show you the workshop. Yeah, workshop. Yeah, let's do that. Yeah, take that one also. Can take up the.
Now, this session was extremely informative. Definitely we have a part 2, especially with our pharmacists. And someone from Manville just said to me, remember, we are over there. It's not all about Kingston. So we are very conscious. Okay, Mr. Reed, I heard you. So we are conscious of that we will find a way to bring all these parents together, to educate them, so that their children can be then informed information. We're almost at the end of the session, but what we're going to be doing now is to just relax and to allow our children to entertain us for this final item before we say thank you. Thank you so much.
You're welcome, Ms. McCoy.
Thank you so much. This is something that this year we're looking at healthcare, right? And we need to look at the symposium because I think a lot of the professionals, the healthcare professionals, need to sit at a table with the doctor to understand that it's not what they do. It's about.
I agree.
Look on the crime rate by Janessa. Look on the crime rate. The island in a still look on the crime rate. Do not party, look on the crime rate. He give my belly ache. Whoa, belly ache. Look on the crime rate. More deaths and death, look on the crime rate. Me say me afraid for go again, look on the crime rate. Now stay a street late, look on the crime rate. Don't stop. It's too great, too great, too great. Drop the crime rate. Take it to a lower level. Drop the crime rate. And let we stamp out the devil. Drop the crime rate. And let we do the jiggy jiggy. Drop the crime rate. And let we do the weddy weddy.
And we were just whetting your appetite a little. Just to say that these students entered the JCDC competition. This time they didn't get a chance to get the gold, but it was valuable experience for them at the parish level. We wanted to have more items for you, but the next time we meet, we'll definitely have you watch them doing the African praise. Another group of students. We have very talented students in our system, and we need to open up opportunities for them to showcase what it is that they can do. And we are seriously looking at a particular production where we can air or to showcase these talents in another year or two. So stay tuned. I just want to end this AGM public session by thanking all of our partners, the Ministry of Education, Youth, Skills, Youth and Information. Thank you, Mrs. Williams, for being here. I also like to extend to Mr. Nakagawa, and ladies and gentlemen, he's very new to Jamaica. Please give him our Jamaican welcome. Mr. Nakagawa is just here. It's not yet a month. So he is pretty new. And usually, when our JICA representatives come, the first place they get to is where? Jade. They have established a routine over the years. They have always been supporting our programs. So, sir, we welcome to Jamaica officially, and we look forward to a continued relationship with JICA Jamaica. And finally, our heart trust, Ms. Sheon, she left, but I'd just like to say that Ms. Palmer has been a really strong support of our program here at Jade. She sits with us. She listens to the challenges. It was so what she was referring to not so long ago was the assessment that took place just a few days ago. And what they utilized was a strategy that all the assessors use for persons without disabilities. And the poor assessor got a first-hand experience of the frustration that the young people experienced, and the fact that they came for one session to assess the children, and they had to turn it into two. So that was a lesson learned. But just to say that we continue the conversation, we continue the dialogue until we get it right. But the essence of the relationship, the partnership, is that we need to work together to come up with a product that meets the needs of the people we serve. Ladies and gentlemen, or principals, or teachers, or parents coming from outside of Kingston, I want to say thank you. It took effort to get here. Mr. Reed all the way from Landilo, from Westmoreland and St. Elizabeth. Thank you, ladies and gentlemen, for coming. And we look forward to working with you over the year as we implement programs to strengthen or to improve the lives of people we serve. We have now come to the end of our annual general meeting 2025. And I'd like to say, officially on behalf of our president, Dr. Joan Reed, thank you very much for coming. And lunch is provided. So on your way out, we encourage you to just take a prepared box with you as you move ahead. And the lunch is being served on the outside to my right. Thank you, ladies and gentlemen. Have a great day.